Hi, I'm Craig Alford from Active Orthopedics Physical Therapy in Midland, Michigan. I'm here today to talk about what to expect following shoulder surgery. What I mean by shoulder surgery could be a rotator cuff repair, could be a subacromial decompression, could be an excision of the distal clavicle, could be a slap repair. We see a lot of those here in town, and one thing tends to occur over and over, and that's patients really don't they go into surgery being informed by the physician, but they really don't know exactly what to expect following surgery. So what we hope to do today is talk a little bit about what to expect so that you can get through the first couple of days, which tend to be the worst, with as little discomfort as possible. First thing to expect, you're going to have surgery typically in the morning. The physician should instruct you to be there at a certain time. You'll know what to go through as far as the day of. When you leave typically the day of surgery, you should expect that you'll be still, for the most part, numb in the shoulder. They'll administer, in most cases, a nerve block, which will probably start to dissipate later in the evening or early in your sleeping hours. When this does, your pain is probably going to come on pretty abruptly, so make sure that you can stick with the prescription that your physician gave you, and whether you're having pain early in the evening or not, continue to take what's been prescribed. The next day, you should anticipate that your arm's going to still be in a sling, unless prescribed otherwise by the physician. Keep the arm in the sling, but often the physician will ask that you do what we call pendulum exercises on a daily basis. The pendulum exercises are meant to be a passive exercise, which doesn't involve a lot of muscle activity, simply a hanging or a stretching of the shoulder. I've asked Kyle, Central Michigan student in physical therapy, to demonstrate the pendulum exercises for us. First, I'm asking him to do the correct way, which is a passive technique, where simply he lets his arm hang and initiates all the motion from his body. Kyle's right now doing it in the forward and backward direction. I'd like him to widen his base and do a little bit from the side to side direction. And from this position, he can also do a clockwise and counterclockwise stirring motion of the shoulder. Notice that the motion again is coming from Kyle's body. It's not being initiated from his shoulder. One of the most common things that we see patients do first day or first few days after therapy is to do this exercise actively, which often leads to increased muscle soreness. Kyle right now is moving all from his shoulder, which is an active exercise, and if you had a rotator cuff repair, your surgeon does not likely want you to do this. Forward and backward direction doing it actively also is going to lead to some soreness. So if you watch him again, he's going to do passively, making sure that the motion is coming from his hips and his body. Good. Once you start physical therapy, which depending on the surgery that you have, we will likely get you going on to pendulum exercises, also work on some elbow flexion, some forearm supination and pronation, some wrist mobility, and some gripping exercises. Your physician will likely prescribe this in advance as well. Once you start physical therapy, you'll become familiar with the pulley exercise, which is another passive or active assistive exercise which we initiate early on. Kyle's going to demonstrate how to do the pulley again. Note that if Kyle were to have surgery on his right shoulder, the right shoulder is meant to be passive during this exercise. The left shoulder is the motor force doing all of the work. Basically, I'll ask them to simply hang on lightly with the grip and let your left shoulder do the pulling down, which will gradually pull your right shoulder up. Early in the process, if you can get your arm to approximately 90 degrees of flexion, that's a good start. Don't force this, and it's meant to be a slow, controlled exercise, typically lasting between 3 and 5 minutes, slowly working in the upward direction. And again, if it's his right shoulder, we'll slowly turn his torso to the right, which will relatively bring his arm out to the side. This in combination with the elbow, forearm, wrist, and hand, and pendulum exercise is a great start for most rotator cuff or shoulder surgeries. Again, your physician will dictate exactly what you can do, and certainly the physician will be in contact with the physical therapy department to let them know any precautions that may arise as well. Okay.